Hello everyone, welcome to another episode of Learning on Smartnursing. Today we want to look at disaster management and how best we can help or play our part in aiding disaster management. We will take a look at the steps or the stages in disaster management and what they stand for. So without not wasting much time, let's just get right into it. My name is Miss Evelyn as usual. So first of all, what is disaster? A disaster is any unplanned event that has a serious toll on our resources, on our environment, on our health, and it affects all spheres of life. Disaster can be natural, it can be man-made. Natural disasters, for example, can be a flood, it can be fires, it can be hurricanes, okay, and then man-made ones could be chemical spills, it could be a gas explosion or an atomic explosion. So the disaster circle is an integrated loop where we look at holistically how to manage disaster, how to approach disasters, and how to manage them effectively. The main objectives of disaster management most of the times is to enhance rapid response. You want to encourage collaboration. You want to also promote a speedy recovery, okay, and you also want to make sure that you take steps in guiding the fact that they don't happen anymore. So basically, a disaster circle, which we'll be looking at, involve these steps, and the steps intertwine. It's like a continuous loop. So one step, goes into the other. Okay, so what are the steps? There are four main stages, but then there's also an expanded one that we will look at later. So the four main stages are mitigation or prevention, preparedness, response, and then recovery. Mitigation, it involves the practices or the steps that we put in place to prevent the long-term happening or long-term prevention strategies that you put in place to prevent any disaster at all from happening. Okay, so it is about anticipating that this might happen and then you put measures in place. You don't want it to happen. That is why it's called mitigation or prevention. Okay, remember we said it's a continuous loop. So maybe a disaster has happened and then during the recovery phase, you realize the risks and things that you know brought about the disaster, or during the response phase you realize what brought about the disaster. Then during the mitigation or prevention, you want to put strategies in place that will prevent it from ever happening at all. An example is have a building policy that prevents people from building in waterlogged areas or building near water bodies, okay? Or you have a policy that prevents people from going to landmines and building there, or you have a policy that prevents people from sand winning or quarrying or doing anything possible that can bring about a disaster, okay? Mitigation or prevention also involves education. That is where you go into the community, educate them about your potential hazards, and educate them about the things that they can do or prevent disasters from happening. Okay, another thing that you can do is what we call hazard zoning or mapping. Okay, hazard zoning or mapping is when you identify where you are. If you are an organization, you're a hospital, you're a corporate entity, a market, wherever you find, or even an individual at your various homes, you can identify the potential hazards in your area and then you prepare accordingly. For example, if you live in an area where there are water bodies around, anticipate that you might be having a flood one day. If you're living near an area or you're living in an area that is hurricane prone or there's ever been a hurricane before, then it can happen again. So knowing those hazards tells you that, okay, this miles away from my house, I may have a flood. Okay, maybe there is a gas filling station around you, there's a petrol filling station around you. It's likely that you can have a gas explosion. It is likely that you can have a fire outbreak. And so having those areas in mind tells you how to prepare or how to stay away from such disaster that might happen. Okay, so from mitigation, you're trying to prevent the things from happening. Okay, then you get to preparation where you now prepare yourself solely for the disaster in case it happens. You want to prepare yourself for the disaster in case it happens. So this is where you put actions into place. So at mitigation, you are trying as much as possible to identify the problems and see how best you can prevent them from happening. But that most of the times is like a long-term thing. So when it comes to preparedness, this is action. This is where you now take action, waiting in case it happens. So for example, in health facilities, this is where your drills and your simulations come to play. Okay, you have frequent drills, you have frequent simulations that prepares you towards an impending disaster should it happen. Okay, this is where you make sure that your PPEs are well stocked. Now during prevention, you can make sure you stock your PPEs. You can make sure that you do all your infection prevention trainings, you do all your your assessment to make sure that everywhere is ready or everything is ready. But during preparedness, it is practical. So this is where you now practice your IPCs. Okay, this is where you now practice or you do your drills, your simulations. Should in case we have a disaster, how do we go about it? This is where you make sure that your incident command system is working. Okay, this is where you make sure that your emergency response team is up and doing. Okay, an emergency response team is a team that comprised of a multidisciplinary, you know, expertise. You will have your nurses on board, you have your anesthetists on board, you have your cleaners, you have your procurement officers, okay, your administration, you have your finance people on board because you will need resources when it comes to disaster response when you're responding to disaster. So this is where you make sure that that team is up and doing and everybody is trained. Everybody knows what role to play when it comes to responding to a disaster. Okay, so that the procurement officer will not go and be taking the work of the cleaner, or the cleaner will not go and be fighting or trying to do the work of the nurse. Everybody knows what they are supposed to do, the role they are all supposed to play when it comes to preparedness. Okay, this is where you map your triage areas. You put everything in place. So in case they bring people to this facility, this is where we want to receive them. This is how we will go about the triaging. This is going to be our entry point and this is going to be our exit point. This is where the ambulance will come through and this is where the ambulance will pass and go out. This is the area the media people will stay and this is where the PRO will meet them. Okay, the incident commander is standing here and it is communicating to those in the old area this way. When it comes to mapping it out, you have an area called the bronze, you can have your gold, and you can have your gray, whichever color you want to, assign to it. Where people are operational, where the operational workers are working, it's not supposed to be interfered with anybody. So you make sure that everybody in the team knows the role that they will play. All right. So this is how we go about it. Everybody knows the role they are supposed to play. This is what you do during preparedness, and that is why simulations and drills are very, very important. Okay. Mind you, you had already zoned out your area, you zone out. And so this is something, like I said, that can be done by individuals, can be done by corporate entities, it can be done by health facilities, a country, can be done by the continent, I mean, or sub-region. You know what the risks are in your place. For example, if you're in an area that is prone to hurricanes, you know. You're an area that is prone to fires, you know. So this is not the time that you will be taken by surprise. So ideally, your long-term planning during mitigation, you have a complete emergency plan. Okay, you have a response plan ready, and it has to be flexible enough. Okay, so that when it comes to some contingencies and you need to make some adjustments somewhere, you do that. All right. So you have a plan, and then when it comes to preparedness, you make sure the plan comes to life. So you do simulation, assume there is a scenario, and you play it out, and you make sure that you get serious enough, because that is how you will respond during a real disaster should it happen. All right, so that is for preparedness. So far, we've been talking about the disaster management circle. We spoke about mitigation, where we are preventing and we put in place long-term plans. Okay, and then we move into preparedness when we zone it out now and now try to put our plans into action. All right, this is smart nursing. And then if you have watched so far, what are you waiting for? Give us a like if this video is helpful to you. We'll be very, very glad to know your feedback. Okay, so now let's look at response. Okay, remember we said we have mitigation, we have preparedness, we have response, and then we have recovery. So let's look at response. Okay, so during response, this is where we put actions in place in order to curb the effect of the disaster. You're activating your emergency response and making sure that you're looking for victims, and making sure you are triaging appropriately, and you are acting promptly. All right, so all the preparedness that you do during your preparation stage, this is where you put them in place. Now it is real, it is now live. So you will receive your patients, all the trainings that you had on your BLS or your ACLS, your disaster management triaging, your MCAT, CISCAT, whatever training you had. This is where you now put them in place. Okay, this is where you will triage people according to priorities, according to their injuries, and then you act immediately. So at this point, it is about reducing the impact. Like, you don't want to worsen the case, you want to recover as many as possible, you want to keep the impact, you don't want it to degenerate. Okay, so this is where you make sure that you are able to contain whatever the problem is. So you look for those who are affected, you take care of them. Those who are still to be rescued, this is where you rescue them. This is where your fire service people will come into place. This is where your rescue teams will come into place. This is where your security people will come. This is where you search for victims. You make sure you comb around the area that the disaster happened, so that you don't leave anybody, you know, unattended to. Okay, so responding is timely, and it is very, very important. That is why you need to be preparing yourselves towards it, because at this point, time is life. Every second lost without finding someone could worsen whatever problem or issue or effect the disaster has had on that person. Imagine someone that is drowning, or someone that is burning, or someone that is, you know, under some broken walls somewhere, under some, you know, very, very bad situations where you need to immediately attend to, and you are not able to do that in time, then you're going to worsen the situation. So during response, your expertise, your skills, all your training, the education, the hard work, the practice, this is where they come.
Okay, that is very, very important, because psychologically, I mean, everybody breaks down, especially when you don't plan for an event and it just happens. So you need to have psychological care as part of your response activity. Okay, so that brings us to recovery. Now during recovery, like I said earlier, it's a continuum. Okay, so now you have response to the disaster, and you now want to recover.
You're going to have long-term and short-term goals. So during your short term, your concentration is on your basic needs, your basic, you know, needs. I mean, the basic things for survival, like water supply, like electricity, okay, like food.
Disasters can be anything. Okay, we are talking about, massive mass casualties, yes, but we can also have maybe um someone had an arrest somewhere, someone has a cardiac arrest, a respiratory arrest, and maybe there was just something small that somebody could do to save the life of that person. So it's very important to continue our community engagement, okay? Wherever you find yourselves, like in my country, your market, your churches, your mosques, go there, train them on basic life support, how to respond, how to approach these things as first responders. Okay, make sure you have your AEDs, your basic airway equipment, basic things. In your markets, you should have them at vantage points. Your filling stations, they should be there. In your banks, wherever people gather, all social gatherings, you should have those things there, and keep training the people. You might never know, okay, what these things can do. So we need to have a lot of community engagement in training our people. Then we also have to make our plans flexible. You have to be very flexible, keep them open, so that in case in a contingency something needs to switch quickly, then you can switch. Don't say that, well, this is how we do it, strictly it has to go by this standard. If this person is not there, we can't do that. No, you need to make it flexible so that you can adapt it to situations, and make sure that it is multidisciplinary, sectorial. Make sure your NGOs are part, make sure government is part, because when it comes to disaster, no one person can do it alone. The government will need help, the NGOs will need help, security people, health facilities, locals, authorities, the chiefs, opinion leaders, they all come into play. So when you're having your preparedness, you involve all these people. Let them all bring their thoughts. Let them all bring on board what they have, what they can offer. All right? Let them come together, tell you what they can offer, and you put everything together. And then at the end of the day, you try to do the best that you can with what you have. So those are some of the key principles in disaster management. Now, what can we do as health practitioners or nurses? What are some of the roles that we can play as health practitioners or nurses in response to disasters? The number one is that we need to make sure that we have all PPEs in stock. How do we do that? Make sure you press on all those who are supposed to provide, your procurement officers, your management. Press on them, let them provide them. If they don't have them, they also need to collaborate. That is why it's a teamwork. So they can also tap people next to them, NGOs, government, whoever can provide. Make sure that all the time you have PPEs available. Okay, so you as a nurse, you make sure that you push for those things. Now, aside your PPEs, make sure you are trained in IPC, okay, and so that when it comes to the response phase, you can practice your IPC very well. Infection prevention control is very important, and so when you are coming to respond to these things, you have to make sure that you play according to standard, okay? Because when it's like a chemical spillage, you have to make sure that the scene is safe. If it's an electrical fault, you make sure the scene is safe. Make sure you are wearing the right PPE. Make sure you know how to don and how to doff, how to use what for what. Okay, so that is your responsibility, and whoever is responsible for the training, you have to make sure that you are trained. You have to demand for it. Make sure that you are trained so that you can respond appropriately. Make sure you know how to triage people in disasters. All right, this is, you are not coming to learn it when it happens. No, It is your responsibility. You must know. That is how you can also contribute your quota. That is how you can also help. All right. So make sure you know how to do all these things so that when it happens, you will not be found one. So in mitigation, make sure that advocate for a safe hospital infrastructure. If you feel that your hospital you're working in is not safe, you need to advocate for it. Suggest what you think should be done. Suggest where you think you can fix, okay? If you don't know where to pass, should in case anything happens, make sure the signs are there. Make sure the place is well demarcated. This is our triage area. This is this, this is that. When it happens, let's do this, let's do that. If there are some hanging wires, you know, some broken walls or all that, advocate for safety. Say something. All right, don't just stand aloof. Okay, so what else can you do, or what can you do during preparedness? Your responsibility here, for example, is to make sure you participate in drills and simulations. Involve yourself. Okay, participate in the drills. These things are such that if you don't keep doing them, you forget. They are not things that we do every day. So once in a while, when they organize a simulation or a drill, make sure you involve yourself in it. All right, the trainings, the IPC trainings, the drills, the triaging simulations, they are all your responsibility to make sure you partake in them. Now, how about recovery? What can you do during recovery? You need to play a very key role in rehabilitating your people who were victims. How best can you reintegrate them into the society? How can you help them psychologically? Okay, this is where your care plans come in. You know, this is where your interactions come in. This is where you care for their psychological needs. This is where you bring in psychological support. Okay, so during recovery, your help in getting the people rehabilitated is very, very important. Now, when it comes to response, you make sure you triage appropriately. Make sure you do the good for the right number of people. Make sure you are triaging promptly. Make sure you are intervening promptly. Make sure you are setting IV lines when you need to. Make sure you are, you know, doing your triage aids like your IV fluids. Okay, and then during rehabilitation or during recovery, this is where you rehabilitate your people. Make sure you are involved in their psychological treatment, their psychological needs, and you are doing it right, because like I said earlier on, they are usually stressed at this point. Okay, so what are some of the challenges? I mean, nothing goes without challenges. So there are some challenges in disaster management. One of them is funding. It's always capitalist intensive, because getting your resources, getting people together, your PPEs, you know, meetings, fuel, is money, especially during your preparedness or your mitigation phase, when you are doing educations and you are going up and down. It needs money to do that. So sometimes funding becomes a problem, and that is why we advocate for a multi, you know, corporate approach. Okay, NGO should be there. Let other benevolent people be part of the planning. Let the government be part of the planning, so that you will not have issues with funding and supplies. Another challenge most at times is lack of, you know, community awareness. Lack of community awareness. Like I said earlier, this cannot be overemphasized. Okay, the community people, the locals, are usually the first on the scene. They are the people who the first to arrive at the scene. They are the first responders. They will blow the whistle. They need to know what to do. Somebody needs to know that when I meet a patient on the floor gasping, I should be able to do something. Okay, so lack of community awareness is another challenge. Another challenge is political interference. Political interference. change of policies. Maybe this political party who was in government made this policy, the other one will come and say, no, this does not fit into my plans, this will not help, I need to change it. At the end of the day, you don't have a continuum of how things should go. It changes as and when people deem fit. Policies change with change of government, and then it affects how we respond. Another challenge is climate change. Okay, maybe you know that at this part of the year, or maybe this particular time during summer, during dry season, this is where we are prone to, or our community is usually struck with bushfires. But because of climate change, some point in January, some point in March, there are bushes burning. So because of climate change, you don't anticipate things, you don't plan for things, and they just happen. Okay, and that can put a toll on you. So in conclusion, the disaster management circle is a continuum of activities that loop into each other that we do in order to prepare, in order to prevent, in order to act, okay, promptly when a disaster happens. We also go through these processes so that we can assess the risks that we have, okay, as individuals, as corporate entities, as a government, as a country. We also want to know the circle, or go through this circle, so that it can guide our thoughts in how to arrange resources for disasters when they happen, what to do when disasters happen, and then even at the long term, after the dust settles, what is next? What can we do to prevent it? And that is why it is a continuum. The lessons that you learn from a stage loops into the other stage, and then it guides your actions during that stage. This has been Smartnursing once again. I hope this video helps you, and if you've learned anything at all, or if this video addressed any problems or issues or questions you had in your mind, we humbly ask that you give us a like, share this video, subscribe to our channel. If it's your first time watching us, kindly subscribe to our channel. If you're a returning subscriber, thank you so much for always being with us. We are grateful for your support. We will see you in another video.